So welcome everyone. I'm Kim Hanson, Executive Director at Diabetes Canada. I'm really glad that you could be with us today for our first ever Cantonese language webinar to talk about diabetes and COVID-19 and the relationship between the two and how you can get supports from our government and how you can care for yourself during this extraordinary time. I wanted to let everybody know before we get going that we are recording this session and we will make it available on our YouTube channel in the next couple of days so that it can be shared with anybody that maybe misses this live session. So feel free to share that with your networks after the fact. I'm so pleased to be joined today by the Member of Parliament for Scarborough Agincourt, Jean Yip, and her colleague Jerome Lai, who's kindly agreed to translate some of our remarks for us. Thank you very much to both of you for being here. I'd also really like to welcome Dr. Calvin Key, who is an endocrinologist practicing in Scarborough, Ontario as well. So welcome everyone and thank you so much for being here.
Thank you for organizing.
Today we're going to be answering some questions that MP Yip has heard from her constituents, that Diabetes Canada has heard from our constituents about diabetes and COVID-19. We'll also be taking questions from our viewers. So the lines have all been muted just to kind of keep the audio a little bit tidier, but you can feel free to ask any of your questions in the chat function at the bottom of your screen. Just type in your question and we'll be sure to answer it as we go through the webinar. We'll be really pleased to receive them. So MP Yip, let's please start with you. We know that diabetes is a large burden for many Chinese Canadians. Tell us more about that and tell us how our government is helping people affected by diabetes through the COVID-19 pandemic.
Well, hello everyone. Good afternoon. It's my pleasure to join Kim, Dr. Key, and all of you here today. The health and safety of Canadians is really our utmost priority for the federal government. We have a number of benefits that are helping Canadians through this crisis. We introduced the Canada Economic Response Benefit of $2,000 per month to support those who are facing a loss of income due to COVID-19. The Canada Emergency Wage Subsidy helps businesses keep their employees by covering 75% of their wages, up to $847 a week. We helped families with children by providing an extra $300 per child with the Canada Child Benefit. And just yesterday, we announced we're providing a one-time top-up for seniors receiving OAS and GIS, representing a total of $500 for those receiving both. Diabetes is a cause that is important to me personally. It runs on both sides of my family, and I know that it's quite prevalent in the Chinese community. We know that diabetes or prediabetes affects 1 in 3 Canadians and costs our healthcare system $30 billion per year to treat. It's the leading cause. Diabetes is the leading cause of heart disease, stroke, kidney failure, blindness, and amputation. It disproportionately affects vulnerable Canadians, including seniors, lower income earners, and members of various ethnic communities, such as those of African or Indigenous descent. And despite our excellent healthcare system, we rank among the highest in terms of both the prevalence and costs of treating diabetes. Canadians of Chinese descent are more likely to have diabetes despite the fact that they are less likely than the general population to experience obesity. In addition, a 2013 study showed that diabetes is becoming more common among Chinese Canadians at a faster rate than it is for Canadians of European descent. Our government continues to look at ways to support Canadians affected by diabetes, both during and apart from the COVID-19 epidemic.
So I will continue with the translation. 大家午安，好高興可以同 Kim 同埋柯浩銘醫生同大家喺今日參與呢個研討會。保障加拿大人嘅健康同埋安全都係聯邦政府嘅首要任務。政府已經推出多項嘅福利，幫助加拿大人渡過今次嘅難關。我哋推出咗加拿大緊急援助福利 CERB， 每月2000蚊支援收入下跌嘅人。亦都有加拿大緊急工資津貼 CEWS， 幫助企業支付員工75% 嘅工資。幫助企業留住員工。 另外兒童福利金即係俗稱牛奶金，每名兒童係會額外咧獲發300蚊嘅加紙嘅。咁琴日都宣布咗老人金 OAS 同埋保證收入補助金 GIS 咧，合資格嘅長者都會額外咧會收到合共500蚊嘅。糖尿病咧係對葉議員嚟講咧係非常重要嘅課題。佢自己嘅屋企人同埋外家嘅屋企人都有受到影響嘅。佢亦都知道糖尿病喺華人嘅社區係比較普遍。咁我哋知道糖尿病同埋前期糖尿病咧係影響1/3嘅加拿大人，每年對於醫療系統嘅花費咧就有差唔多300億嘅資金咧係治療病人嘅。咁糖尿病亦都係造成心臟病、中風、腎衰竭、失明同埋截肢嘅原因之一。特別影響到弱勢社群啦，包括係老人家、低收入人士、少數族裔。好似非洲裔同埋原住民嘅後裔等等嘅。咁雖然加拿大有先進嘅醫療體制，但係加拿大嘅糖尿病患病率咧同埋醫療成本咧都係最高嘅國家之一。華裔加拿大人係有較高嘅機會患上糖尿病嘅，即使係黐肥嘅人口比例咧係較細。咁2013年嘅研究顯示咧，華裔加拿大人患上糖尿病嘅有上升嘅趨勢啦，咁比起歐洲裔嘅加拿大人更加快嘅呢個上升趨勢。聯邦政府咧係會繼續幫助受糖尿病影響嘅加拿大人渡過今次疫症大流行嘅難關嘅。多謝大家。
Thank you, MP Yip. Thank you, Jerome. Really appreciate that. Now I'd like to welcome Dr. Key. Dr. Key, many Chinese Canadians who are living with diabetes are wondering whether they're at greater risk of COVID-19 because they live with prediabetes or diabetes. What would you tell them?
Well, first, I'd like to thank you for organizing this really great event, Kim, and to Diabetes Canada for their support as well. Well, we know that people with diabetes are at a greater risk of a whole variety of infections, but with COVID-19 being so novel, there's no evidence to specifically support that people with diabetes have a specifically higher risk of getting COVID-19. But we do know that of the people who have diabetes, who are infected with COVID-19, the disease tends to be a bit more severe. So it may require hospitalization, may require intensive care. There may be a greater risk of mortality. Those are all things that we have seen in Canada as well as across the world. It seems to be a pattern. So my best advice for people with diabetes is to really try to control their blood sugar as much as possible, and to try to manage those glycemic targets as much as possible given the current circumstances, because there does seem to be a relationship between impaired blood sugar regulation and the severity of COVID-19 if it does happen. So eating as healthily as possible, taking your medications on time, adjusting the doses of the medications if necessary due to differences in activity levels due to physical distancing measures, and getting exercise as much as possible. So like yoga or doing a daily walk in the neighborhood if it's safe to do so in your community. And as for everyone, it's very important not to forget hand washing properly and distancing and remaining 2 meters away from other people who aren't in your household, wearing a mask to reduce transmission of the virus. These are all important tips for everyone to follow, especially for people with diabetes during this time. And so if you have any further questions, there are a lot of really great website resources on the Diabetes Canada website, www.diabetes.ca, and there is a specific COVID-19 frequently asked question resource that gets updated regularly, and I would really suggest that you take a look at that if you have any more specific questions. And then if you have more questions about your own diabetes on a personal level, there's now a resource where the Diabetes Canada hotline, 1-800-BANTING, B-A-N-T-I-N-G, is available for you to call in with your own maybe more individualized diabetes questions, and there will be a certified diabetes educator who will actually be able to respond to you personally within 24 hours with more advice. We're really happy to have that resource available for people with diabetes. 咁如果自己本身有糖尿病咧，喺患上新冠肺炎嘅時候咧，個病情會比較嚴重嘅。尤其是嗰啲控制唔好血糖水平嘅病人咧，因為控制唔好血糖水平咧，就會影響到你嘅免疫系統啦，削弱嘅抵抗力嘅。所以如果糖尿病人感染到新冠肺炎，出現嘅病發症咧，就有機會比較嚴重，可能有需要深切治療啦，甚至威脅生命嘅。所以咧，我對糖尿病人作出最好嘅意見咧，就係要好好控制血糖水平。第一，大家要注意食物習慣啦。飲食習慣啦，減少澱粉質嘅攝取量啦，同時要準時食藥啦，同埋要如果喺安全嘅情況下咧，就可以出去散下步啊，或者做其他適量嘅運動。唔記得要經常保持雙手清潔啦，洗手時要捽手最少20秒啦，同埋出街時要戴口罩啦，與其他人保持2米嘅距離。如果有其他嘅問題咧，就可以隨時上加拿大糖尿病協會嘅網頁 diabetes.ca 或者打協會嘅英文熱線1800-226-8464，喺24小時內咧就會有一個糖尿病教育者會回覆嘅。
Thank you, Dr. Key. Now, we were talking a little bit before this webinar started about how you are now practicing exclusively virtually medicine, I think. I know my doctor's office is also exclusively virtual. And so for some folks right now, it can be tough to access healthcare, particularly on an in-person basis. So what are you advising patients who are wondering how they can access healthcare and take care of their own diabetes during COVID-19?
Yeah, so one of the biggest misconceptions, I think, is that a lot of people think that all doctors' offices are closed, and certainly even my own clinic and a lot of other doctors' clinics, it's not the case. A lot of family doctors still open and providing services virtually through telephone or using other methods, and a lot of walk-in clinics are still open, providing services. So we're here to support you, and feel free to always reach out to your diabetes care team if you need help. And we're doing our best to continue providing these appointments in a timely way. But remember that if you do have a more serious concern that requires more immediate attention, for example, if you think that you might be very sick with something like diabetic ketoacidosis, you should present to the emergency department in your hospital, and don't be afraid to do that if you really need to, because those services are there. It's important to know that it continues to be available. The hospitals are not closed for emergencies. It's always important to be able to manage your diabetes well, and to do self-care. So just a few tips on self-care. If you have problems checking your feet, it's always makes things easier if you can use a mirror to look at the bottom of your feet to check for any injuries or ulcers that might be developing. It's important to monitor your blood pressure during this time as well. So if you're not able to get into your doctor's office to check your blood pressure, feel free to monitor your blood pressure using a home blood pressure monitor. And you can report those numbers back to your family doctor, your diabetes care team, once you have your appointment. A lot of blood glucose meters now have online reports, so if you're able to sign on to that, you can share that information with your healthcare provider, and that could help to maintain communication and transmission of information during this time. And always consult with your healthcare team if you think that there are some adjustments that need to be made. 因為呢個疫情嘅關係咧，有好多人咧就可能以為全部問診診所都閂晒門。 但係其實有好多醫生咧，都會有電話覆診嘅服務，例如家庭醫生啦，或門診診所醫生啦等等。但如果有緊急嘅需要，或者有嚴重嘅症狀咧，例如酮酸中毒症咧，就要馬上去你醫院嘅急症室。最後同大家分享一啲小 tips 啦。第一，要經常檢查腳部，同埋做腳部護理。如果睇唔到腳底嘅話咧，你就可以用一塊鏡幫助自己。第二，如果去唔到診所檢查血壓咧，你就可以買一部量血壓機，自己檢查血壓。第三，最重要就係經常檢查血糖水平。第四，如果覺得有其他問題嘅話咧，就馬上聯絡你嘅糖尿病護理團隊。
Those are really great tips. Thank you so much, Dr. Key. Now, if I may, I'd like to take a couple of moments to talk to our viewers about how Diabetes Canada is offering supports to people during COVID-19. First of all, I want to start by saying that now more than ever, we are here for Canadians affected by diabetes. We know that many people have questions and even concerns about what the pandemic may mean for them or about how to manage diabetes at this time. And we are still here to meet those needs. We're, of course, like everyone, doing it more virtually than we used to, and we're doing it remotely. But that's actually a great opportunity for us to hopefully reach more Canadians with resources that are now available on our website and our YouTube channel, such as this one. So for example, as Dr. Key kindly mentioned, please feel free to call our information line, 1-800-BANTING, BANTING, if you've got any questions about government programs that you might be able to access to help with the costs of diabetes medications or devices or supplies. If you've got questions about other government programs such as financial supports, maybe you'd like to know more about whether you might be able to apply for the disability tax credit, things like that. We also just recently, and thanks to tremendous support from wonderful diabetes educators who are volunteering their time and expertise, we're able to offer personalized medical advice about diabetes via our 1-800 line. So call 1-800-BANTING if you have questions about your own diabetes management. And within 48 hours, somebody will return your call and offer you some guidance based on your specific circumstances. We are maintaining a website, diabetes.ca/coronavirus, that has lots of great resources on it. Dr. Key mentioned the FAQs, or frequently asked questions document, which is there. It also has a number of tip sheets and things that you might find useful. For example, there's an infographic that you can give to your pharmacist if your pharmacist is maybe questioning any difference in the amounts of your diabetes medications that you may be needing while you are perhaps a bit less physically active while we're all at home. You can also print off a letter there if you're experiencing any challenges in getting your employer to offer accommodations that you may need as we start to return to work. We've started producing every week a video series that we call Ask the Experts, where Canadians can send us their questions via social media or by emailing us, and we get experts in diabetes from across the country to answer those questions every week. So they're released as a video series, usually every Friday, and they're available on our YouTube channel and can be a great resource if you've got questions about various aspects of diabetes and COVID-19. We're working on plans to bring you virtual conferences. For example, we're planning to have a virtual conference for people living with type 1. We're really excited about that. We normally hold camps for kids with type 1 diabetes every summer. We can't do that this year due to physical distancing. but we're going to offer a virtual camping experience for them anyway, and that's something we're really keen about. We're also working to keep your healthcare providers informed and up to date on the latest research. And so those are doctors like Dr. Key, also the nurse educators and dietitians who support those of us who live with diabetes in living well. And we offer them a webinar series that helps them stay abreast of not just the latest research about diabetes and corona and the link between the two, but also to get tips on how they can have more effective virtual patient meetings, given that that's a new technology for some of us. And we've just recently announced plans to introduce, starting very soon, a webinar series for people who may have been more recently diagnosed with type 2 diabetes. Normally, if somebody is diagnosed with type 2 diabetes, they would typically be offered a diabetes education program quite quickly after diagnosis. And that's not necessarily available in all cases right now. So we'll try to fill that gap with a webinar series. So if you know someone who may have received a more recent diagnosis of type 2 and just be wondering, what do I do? Please do direct them to our website, our social media feed, to get more information about that. And we're really, excuse me, trying to stay connected with you via our social media channels and via forums like this to make sure that we understand any barriers that you're experiencing. And we're working to advocate and partner with governments across the country to help address those barriers. So with that said, maybe I'll just ask Jerome if you could perhaps recap a couple of my remarks there in Cantonese, and I'll also invite any of our viewers to send in any questions that you may have now. We'll sort of open the floor at this point. So Jerome? You may just need to unmute yourself, Jerome. There you go.
So thank you. So I'll recap some of the resources that Kim just mentioned. 好多謝柯浩銘醫生同埋葉嘉麗議員去講解同埋俾咗佢哋嘅建議啦。Kim 咧都想分享翻加拿大糖尿病協會嘅一啲資源啦，可以分享俾大家去幫到大家係度過喺呢個疫症嘅期間咧係度過嘅。加拿大糖尿病協會咧，雖然係疫症期間咧，亦都係會繼續工作嘅。但係好多嘅服務咧都係搬到上去網上啦，或者係電話嘅。咁可以打電話嘅話，可以打電話去1800 Banting BANTING， 或者去電郵到 info@diabetes.ca 去詢問問題嘅，咁亦都可以去到佢網站啦 diabetes.ca coronavirus。咁咧網上邊咧亦都會定期咧發放一啲專家嘅一啲嘅短片啦，或者一啲視頻嘅，咁就係會喺 YouTube channel 啦，或者係其他同埋喺其他嘅社交平台度發放嘅。嚟緊咧亦都有好多唔同嘅網上嘅研討會啦，咁係俾翻大家咧去聽翻唔同專家嘅意見啊，係關於糖尿病呢方面嘅知識嘅，咁大家可以上糖尿病協會嘅網站咧去留意翻嘅。咁另外咧亦都會分享翻呢一啲研討會上邊都會分享翻一啲咧最近期嘅一啲研究嘅資料啦，係關於今次嘅新冠肺炎疫情啦，同埋係糖尿病嘅一啲嘅相關嘅資料嘅。另外咧，如果亦都網上邊咧，協會嘅網上邊咧，亦都有啲表格啦，或者一啲已經預先做好咗嘅一啲嘅信啦，咁就可以你可以睇翻啦，有冇需要可以俾你嘅藥劑師啊或者醫生嘅時候咧去幫助你 即係喺呢個疫情期間咧，喺一啲嘅醫藥上啊或者醫療上嘅問題咧，都可以容易啲去應對嘅。咁大致上咧就係咁多啦。咁如果有問題嘅話咧，可以聯絡翻加拿大糖尿病協會啦，或者係你哋自己嘅醫生或者專家嘅意見啦。咁亦都可以揾翻葉嘉麗議員辦公室啦，我哋去問嘅。如果係你係住喺士嘉堡或者靜港區嘅話，多謝。Thank you.
Thank you so much. Really appreciate that. So we actually have 2 questions that we received by email earlier this afternoon. And again, we'd love to take any questions from our viewers. So please just feel free to type your question in to the chat box at the bottom of your screen, and we'll be happy to answer it. So we'll start first with a question for MP Yip. The person that's emailed us has a couple of family members who live with diabetes and with whom they live, and they work in a customer-facing kind of area. And so they're concerned about going back to work as the economies start to reopen across the country. And so I wonder, MP Yip, what would your advice be for someone who is not themselves necessarily immunocompromised, but is worried about putting someone close to them who is at risk? Do government programs such as CERB apply in those cases? Or what would that person be best advised to do you think?
Well, I think it would be good to go back to their employer and to find out what kind of protections they have in place given by the city guidelines as well as the provincial guidelines, because they are the ones really who are determining the regulations and advice for workplace safety. That's the first thing I would do. And secondly, there must be appropriate social distancing, especially because of potentially any vulnerable persons in the workplace. And I would also say if they're that vulnerable, perhaps those persons, their return to the workplace should be staggered. And if there is some, I guess, discomfort, wearing protective face masks or cloth masks would be helpful. And also encouraging as many people to continue to work from home. And there is also the wage subsidy, which employers are able to apply for.
Right.
In addition to the CERB. Yeah, and that is to encourage employers to bring back their employees to either stay on the job or to come into work. It's really, I think, it's all those measures that the workplace puts in force as well as themselves. And for the CERB, they do have to reapply every month. So
Right.
I think really just looking at it from a month-to-month case is important.
Excellent advice. Jerome, did you want to offer any of MP Yip's response?
Sure. 咁頭先就問到咧，嚟緊都可能會好快就會重開翻經濟啦，咁就好多店鋪啦或者一啲嘅公司都會重新開門嘅。咁有問題就問到，咁就係如果佢屋企人咧係受到糖尿病嘅影響啦，咁就驚咧，如果佢自己翻工嘅話咧，都會有呢個染到呢個新冠肺炎嘅風險嘅，咁會對自己屋企人咧都會帶來呢個風險。咁究竟可以點樣去應付咧？咁葉議員咧就建議翻啦。咁首先咧關於工作場所裏邊嘅安全規則咧係由呢個省政府同埋市政府去定嘅。咁聯邦政府方面咧都係呼籲翻大家咧，如果係對於條例啊或者係規定方面有問題嘅話，可以參與翻省政府同市政府嘅條例啦。咁就係另外就建議大家咧，即係喺工作場所裏邊都要注意翻，即係安全啦。咁就係即係都要做到翻啲防護嘅措施啦。咁就盡量去 保護自己啦，咁就同人與人之間咧都保持翻啲社交距離啦。頭先醫生都建議咗係2米以上啦。咁就係亦都可以戴一啲布口罩啊，或者係其他類型嘅口罩啦，咁去防止呢個傳染嘅。咁聯邦政府咧亦都有呢個頭先提過嘅工資補貼啦。咁如果僱主係真係想請翻員工去工作嘅話咧，呢樣嘢都幫到手啦。咁亦都呼籲翻盡量留喺屋企工作啦。咁就會減低咗傳染嘅風險啦。另外就係緊急援助基金緊急援助補助金方面咧，即係 CERB 咧亦都有啲條款咧。如果你嘅家人咧係受到疫情嘅影響啦，咁係需要你嘅照顧咧，咁呢啲細節咧都可以上網睇翻啦。咁如果你係符合呢啲嘅條例嘅話咧，或者一啲嘅規定嘅話咧，都可以申請翻嘅。咁又留意翻係每個月都要重新申請一次。咁呢啲就係葉議員俾大家嘅建議啦，同埋一啲嘅。
And I should mention that the CERB is only up to 16 weeks. And so we're hoping that we are on the start of a recovery.
就係翻譯翻就係呢個加拿大緊急援助金咧 CRB 咧係設定咧，而家暫時係16個禮拜嘅。咁而家都係中斷啦，咁就都希望嚟緊係會重開翻嘅，即係經濟會重開翻。
Great, thank you. Those are excellent suggestions, MP Yip. Thank you. Dr. Key, I think this next one is more for you. This person is wondering, really, I think the summary of the question would be, is there a difference in the risk profile for COVID-19 of somebody who is maybe younger and has type 1 diabetes compared with somebody who's maybe older and has type 2 diabetes?
So for COVID-19, there's been a relationship that's been noted among people of different ages. So we're seeing that people at a younger age may have a milder form of the disease, and as people get older, they may have more severe symptoms. So younger people who develop the disease may not even know that they have it, whereas an older person might have more significant symptoms. So from just the age difference alone, there might be a difference that way in terms of the severity. But in terms of the difference between type 1 and type 2 diabetes, there hasn't been any sort of evidence to suggest that there's any difference in the risk of acquiring COVID-19 or in terms of how severely it might manifest. So we would certainly expect that to be very, very similar, but there's not any data to support that there's any difference by diabetes type.
Great, that makes good sense. Did you wish to perhaps repeat that?
Yeah. 咁樣啱啱阿 Kim 想問個問題咧，就係如果有一個後生人有1型糖尿病，同埋一個比較年紀大啲嘅2型糖尿病，感染到新冠肺炎有冇分別咧？咁樣其實我哋見到啲年青人咧感染到新冠肺炎咧嘅症狀會比較輕微，同埋如果老啲嘅話咧，越老就會越嚴重。咁樣所以就呢個年紀嘅分別咧，就會係好大影響係個新冠肺炎嘅症狀，睇下佢幾嚴重。但係1型糖尿病同埋2型糖尿病咧，喺我哋而家認為係兩種糖尿病都係差唔多，唔會話有一種係有高啲風險感染到新冠肺炎。而家係仲未有根據係話有任何分別嘅。
Great. Thank you again. I guess that I'm not seeing any more questions from our other viewers. I wonder, before I conclude this session, I thought I would just open the floor to MP Yip and to you, Dr. Key, to add any final remarks that you might have for our viewers.
Sure, I'll go ahead. That's all right. I would just like to mention a few recent initiatives that the federal government has done for diabetes. First, Health Canada has put towards $229 million towards diabetic research, and 48 million of that was in 2018 and 2019. And I know that Diabetes Canada was just in Ottawa the other day, right, at the Health Committee. Yeah, and talking about the impact of COVID-19. So it's important to see you up on the Hill. So thank you for that.
Thank you,
And
MP Yip.
secondly, my colleague, Member of Parliament Sonia Sidhu, she introduced a bill to establish a national framework for diabetes. And that looks at identifying training, education, guidance needs for healthcare and other professionals related to the treatment of diabetes, as well as promoting research. And I think what's really important is data collection on diabetes prevention and treatment, because without collecting some good data, you can't develop policy. And we also don't know how effective the recommendations would be, so that's very helpful. And also looking at existing diabetes prevention, and looking at best practices, including on addressing health inequalities among various groups. And just last week, the Prime Minister announced $240 million to develop, expand, and launch virtual care and mental health tools to help Canadians access virtual healthcare through telephone, text, and video conferencing. So I thought it was interesting that it's also by telephone and text. So if you don't happen to have a laptop with a camera, you can still access some sort of healthcare there. And November, there is a motion to have November noted as the Diabetes Awareness Month. And I think that there needs to be a lot of prevention or education in order to prevent diabetes. Because if we can get people in the pre-diabetes or even before to adopt healthy lifestyles, healthy diets, I think it can go a long way to keeping people happier, healthier, and lowering our healthcare costs for everybody. And I just have something to say about being Chinese Canadian. We all like our rice. 好多人好鍾意食飯. Well, 食多啲菜, eat those dark greens, because I think it's better to have that fiber, lower your blood sugar. We all like carbs, and remember, rice is a carb. And anything to keep those sugar levels down would be healthier. Especially sometimes we are fooled because many Chinese Canadians, they do not suffer obesity or live with obesity, and so they feel that they're just fine. My late husband was that way, very skinny. And I myself, you know, if you like to eat a lot, then you must exercise and you have to watch what you're eating. And we have a relatively new Canada food guide that's out that really, I'll show you, it looks like this. I don't know if you can see that, but it really now focuses more on looking at different proteins that different ethnic communities may have. For example, in the Chinese community, we have tofu that can substitute for meat proteins. There's less emphasis on dairy products and more on beans as well as whole grains. So it's important to look at these alternatives. And also we have a participation app. You can just go to the App Store and sign up for that, and that keeps track of your physical activities. So good eating and good fitness will keep everybody a lot healthier. So thank you very much. Also, Kimberley and Diabetes Canada for organizing this. And Dr. Key, I really liked your self-care tips. Those are good.
MP Yip, thank you for all of those remarks. I think you had some excellent tips in there, as well as some really important points. And if I can just insert myself before we hear from you, Dr. Key, I wanted to just note that Diabetes Canada is extremely grateful to have been able to appear before the Health Committee earlier this week. We'll be sharing that appearance on our social media feeds, so stay tuned if you've got any interest in watching that. But one of the things that we were talking about there is the importance of embracing a nationwide diabetes strategy, and particularly in light of what we've all experienced with this pandemic. Diabetes Canada has a proposed Diabetes 360 nationwide strategy. You can learn more about it at our website, diabetes.ca/strategy. And it calls for many of the things that MP Yip just mentioned. It calls for a nationwide framework, such as is referenced in MP Sidhu's excellent private members bill, which we're very supportive of and very grateful for. It calls for better use of data about patient health to inform decision-making about how we care for people affected by diabetes. And it calls for more widespread use of virtual care technologies so that Canadians can benefit from excellent health care regardless of where they live. Those are just some of the recommendations. There are so many more, but we've seen during this pandemic how people who may not have stable incomes, stable sources of employment, stable living arrangements are so much more at risk to this pandemic. We've seen how people who live with chronic conditions like diabetes are more at risk to this pandemic. Those, to me, are strong incentive to really slay this dragon of diabetes once and for all. And I think that the timing couldn't be better, because in 2021, the world will celebrate 100 years since a doctor discovered insulin in Canada. Dr. Banting and his colleagues discovered insulin in 1921 in Toronto, and we need to be able to celebrate that 100th anniversary by embracing a national approach to truly end the diabetes epidemic. Now, I apologize, I didn't give Jerome a chance to recap what MP Yip just had to say, so I'll pause and invite Jerome to speak and then talk to Dr. Key.
Thank you. 咁頭先葉議員咧亦都講到加拿大衛生部咧亦都係宣布咗政府係會撥款2.29億咧去支援呢個糖尿病嘅研究啦。咁另外就係上年咧都已經係撥款咗4800萬㗎啦。咁另外就有另一個國會議員MP Sidhu。咁就喺國會咧，亦都係有動議咗咧，係會有一個法案嘅，咁就係會有個全國嘅糖尿病嘅一個政策啦，或者一個叫方針啦，咁就係會加強宣傳啦、教育啦，呢個糖尿病嘅一啲資訊啦，咁亦都係預防翻及早預防呢個糖尿病啦，咁另外就係亦動議都包括咗咧係11月份咧就係會係糖尿病月嘅，咁嗰個月咧亦都係糖尿病嘅關注月啦，咁嗰個月都係想帶動翻大家去關注翻糖尿病嘅病人啦，同埋預防翻呢方面嘅知識嘅，咁另外就有政府亦都撥款咗去喺疫症期間啦，咁就係多啲有網上同埋一啲嘅視像嘅，同埋一啲電話同埋短信上幫助大家去得到呢啲嘅醫療嘅資訊啦，或者係睇醫生啦。但係因為疫情嘅關係，唔可以面對面對住醫生同埋醫護人員咧，咁就可以透過呢個視像方式啦、網上啦、電話或者短信嘅。咁另外都有一個網上嘅資源啦，就係叫 Facilitation App 啦，咁就可以大家可以喺一個手機度下載翻啦，咁就可以跟蹤到你自己做過啲咩運動啊，或者係需要做啲乜嘢去令到自己健康啲啦。咁另外就係有個提到，葉議員都提到一個嘅。聯邦政府都出咗一個食物指南嘅，頭先佢都有擺喺鏡頭上邊俾大家睇到啦。咁亦都係 比以前嘅食物指南咧係有少少改動嘅，咁就配合翻唔同種族嘅飲食習慣啦，咁亦都可以有均衡嘅飲食，咁有啲健康啲嘅飲食習慣飲食嘅安排啦，咁亦都提到華人社會係比較多食米飯嘅，咁就呢樣嘢可能會對於血糖方面會有個影響咯，咁就呢樣嘢要關注一下嘅。咁如果食多咗嘅，咁就做翻啲運動咯。咁呢個就係葉議員嘅建議啦。咁大致上就係咁樣。咁另外另外就係加拿大糖尿病協會亦都係喺較早前嘅國會嘅一啲嘅委員會咧，亦都有參與到啦，亦都有係發表過一啲嘅建議嘅。咁亦都好高興加拿大糖尿病協會嘅參與。Thank you.
Thank you, Jerome. Dr. Key, did you have any final words for our viewers?
Yes, so I mean, during this COVID-19 pandemic, we're all sort of learning on the fly. We've had to make huge changes to our lives that have been stressful to many of us, doing things that we're not used to doing, and in different ways just to cope with this pandemic that's going on. And I'd like everyone to keep in mind that your diabetes care team is always there. Don't be afraid to reach out. There's lots of resources to support you from your team as well as from Diabetes Canada. And I'd like to really thank Kim as well as MP Yip for participating today and for organizing such a really great event. 咁我想多謝加拿大糖尿病協會安排一個咁好嘅節目啦，希望大家會繼續努力保持身體健康。
Thank you both, MP Yip, Dr. Key, Jerome. Really, really appreciate your participation today. I'd really like to thank our viewers. Thanks to those of you who tuned in to watch and to anyone who chooses to watch this after the fact. Please, if you've got questions, never hesitate to reach out. Diabetes Canada is here for you. Visit our website, email us at info@diabetes.ca, or call us at 1-800-BANTING. Please also, if you've got a question about federal government programs, I'm sure MP Yip's office would be very happy to support you, so please reach out to her. And thank you all and be well.